For my project, I wanted to understand the surgical treatment of Parkinson's disease. And in this study, researchers focused on the effects of deep brain stimulation. For this study, researchers wanted to see the impact of deep brain stimulation on Parkinson's disease. While the disease can be treated with medication, it has been found that when preoperatively paired with the levodopa drug, deep brain stimulation helps as well. Researchers focused on the stimulation of the globus pallidus internus and the subthalamic nucleus. Between the two, there is evidence that the stimulation of the STN can be more effective, so researchers decided to focus on that specifically. The purpose was to bring attention to the newly accepted procedure, discuss results of patients who received the treatment, and see how it affected them 6 years after surgery. The study hypothesizes that patients that received the treatment would show improved symptoms of Parkinson's disease. The patient's improvement would consist of better motor ability and regression in symptoms of dyskinesia. Researchers selected 8 patients for surgery based on inclusion criteria that included good health, normal cognitive and affective functions, motor disability, failure of all drug strategies, good response to the levodopa drug, a good functioning level when on brain MRI in the normal range. 21 operations were performed, and the procedures leading up to the operations consisted of radiological studies, head frame succession, and planning for targeting the STN. For the radiological study, patients are exposed to preoperative magnetic resonance imaging, head frame fixation with computed tomography, and intraoperative C-arm studies. The head frame fixation study used the Lexel stereotactic frame system of Elekta. The system takes axial 2 mm thickness volumetric scans, and sets of images are produced. The images are not used for the detection of the target, but they are still used by the software program to determine the values of X, medial lateral, Y, anterior posterior, and Z, superior inferior, of the STN. Once this preparation was done, the images were transferred to the workstation, where the software automatically recognized the images. Images with frame signals are registered, while images without them are classified as working images. Next is the operating theater stage. In this stage, researchers applied the arc with the micro-targeting drive, burr hole, insertion of the electrodes, implantation of the permanent electrode, and implantation of the implantable pulse generator, or IPG. The surgery is done under local anesthesia. Intraoperative neurophysiologic stage is the last stage, and in this stage the procedure is recorded from multiple distances. The neurosurgeon, neurologist, and neurophysiologist present decide on the final position of the electrode. Macroelectrodes are placed in the deepest possible location in the brain. After surgery, patients can be released as soon as 24 hours. This study found that after 6 years of their treatment, one patient developed intraventricular hemorrhage, another patient developed complications and needed their procedure to be retargeted, meaning they needed their electrodes replaced in a different location, and 50% of patients had a significant reduction in their medication dose with significant relief of their tremors. However, it was found the medication's reduction was not the only cause for the patient's surgery success. Patients who had no change in dosage of their medication had axial symptoms and postural instability. This study determined that deep brain stimulation is a reliable treatment for Parkinson's disease. Deep brain stimulation does affect the progress of the illness, and the procedure is also very beneficial because it is reversible and can be removed with no permanent lesion to the patient's brain.